You're in my way.
Previously on Bodies.
Every doctor makes mistakes.
Oh, shit.
Everybody in this hospital knows that Roger makes mistakes again and again and again.
You're asking me to blow the whistle?
Yeah.
No. I won't blow the whistle.
It's not beta.
You had sex with me so you could come to St. Lucia.
Of course I did.
You dozy bend.
You'd have to tell him about us. Do you want to?
Yes. I'll leave him.
There were lots of mistakes. It's my fault she's a cabbage.
When you messed up that crike on Mrs. Strawberry, I covered for you then. I won't anymore.
Why do you want to transfer to a new hospital?
I feel you should know the real reason that this hospital is letting him go.
What the hell is this?
I thought change might be nice.
OK. Let's take a vote on it, shall we?
Well, the patient's under and ready.
Well, bollocks to the patient. Sort out the music first. Jesus Christ, sense of perspective, Polly. Now then, who wants to listen to this instead of my usual? What does it say on the theatre list, right at the top? Polly.
Consultant, Mr. Whitman.
Consultant, Mr. Whitman. Correct. So you lot can fuck right off.
Angela Strawberry.
Angela, the ENT surgeon's going to be here very soon. In the meantime, you've got to let the nebulizer help you breathe.
Rob. Rob.
She's going to need a surgical crike. Get back onto ENT. Air call Mr. Hurley.
She needs it now, Rob.
This isn't a fucking section, Donna. I've never even seen a crike.
You're the closest thing to a surgeon we've got right now. Still got an outlet. Just do it.
Hold the rock fucking steady.
Trying.
Well, try fucking harder. Shit. Fuck. Oh, she's bleeding into her trachea. I don't know what I'm doing. I don't know what I'm doing here, man.
Rob, that's enough.
I had a chance to do a crike and I botched it.
You made an isolated, uncharacteristic error. And if you hadn't have acted, that woman would have died.
She did die.
Rob, I consider this a tragic accident. An accident's where no one's to blame. You're not to blame.
Rob, this is Mrs. Strawberry's son and daughter.
Could anything more have been done to save her?
No. Nothing more could have been done. That's Rob Lake.
The registrar's here for you, Nicola. Sorry, Rob. This is Nicola Quinn, 31-year-old VBAC.
When was the cesarean?
2 years ago for fetal distress. Epidural's in. She's fully dilated, labouring nicely, but she's been having a tiny bit of PV bleeding.
Okay. I can understand you being a little anxious, but a little vaginal bleeding really isn't anything unusual. Any pain? CCG okay?
No pain. CGG's been fine.
Okay. I'm going to do an internal examination, Nicola, if that's okay.
Okay.
All right. There is blood, but it's only a little bit. Everything else seems to be fine. Really no cause for alarm. I'm going to stick around for the next couple of contractions, see how the CTG behaves, OK?
Thanks, Rob.
All right. Good luck.
What's happening?
Help me! Please help me!
What's wrong?
CTG,
Fetal distress.
can you feel what I can feel? Yeah. Prep theatre now. Nicola, I can feel 2 lumps in your abdomen. One is your baby, the other is the uterus. Your womb's ruptured along the old caesarean scar. I'm gonna have to do a new caesarean. You're gonna require a general anaesthetic. Now, if the womb's badly ruptured, I may have to perform a hysterectomy.
No!
We need to do a section now to save you and your baby.
No hysterectomy!
I'll try and repair the wound, but I've got to caution you, if it's ruptured or badly hemorrhaging, then I'm gonna have to perform a hysterectomy to save your life.
No hysterectomy!
I need your consent. I need to get her to theatre now. I need your consent.
Michael, don't let him, please. Don't let him. You know what it means to me. Please don't let
I know
him.
your last child was stillborn. I know how much having a family means to you. But a recognised risk of uterine rupture is having to perform a hysterectomy. If you're bleeding to death and I can't stop it, I'm going to have to take your womb. It's as simple as that. I need your consent. If you don't give it me, I can't operate. Your baby will die. You will die. Thank you. Darlings. Okay. Yes. Right. Let's double clamp for a cold pH, please. Clamp. Scissors. All yours.
Okay to give Cento?
Clamp. Okay. Start the infusion, please.
Air was clear. 40 units in 500 mils over 4 hours.
It's a large dehiscence. There's a lot of bleeding. Green hermitage. Another, please.
Ventilation.
More suction. More suction.
I'm trying, but there's so much blood.
We'll try fucking harder. Green hermitage.
Keep going.
Can't stop the bleeding. Shit.
I know you don't need to hear this, Rob, but her BP's dropping. Sats are going off. 4 more units across match, please, quick as you can.
Doing well.
More suction. Oh, shit. Can't stop this bleeding. Call in Mr. Hurley for me, please. Hazel.
Rob, are you sure?
Call him in now.
Pinking
Give
up
me a
well.
core pH, please, sister.
It's in the memo.
What are you talking about?
There's a memo from O&G admin. All blood tests have to be agreed by the consultant. It's to save money on unnecessary tests.
Get me a core pH now. Clear it with Roger when he comes in. So much blood. Shit.
How's the baby?
Core value 6.9, but she's pinked up on oxygen. Transferring her to Skidoo.
She's a total bloody mess. Tom, how's she doing?
Not good.
She's bleeding out. Why aren't you doing a histo?
I was trying to avoid it.
Stop pissing about. Let's take out the uterus. Spencer Wells, please. We're taking the uterus. Abdo tray, please.
Still bleeding.
This is starting to look like cherry aid.
Fuck's sake, that's all we fucking need.
Tom?
Yeah, I'm on it. Call the blood bank, please. We need 4 units of FFP as quickly as possible, please.
You won't get it without a named consultant say so. It's in the memo. No blood products unless agreed by the consultant.
Fuck's sake.
Well, on my authority, 4 units of FFP straight away, please.
Hematology confirm her FDPs are up.
DIC it is.
Death is coming.
We'll see.
Just kidding.
Sure. Fuck off, Tom.
Rob?
Hey, just chill out, mate. I was just kidding, all right?
There's oozes everywhere here. We're never going to stop this bleeding.
BPs are up. Sats aren't bad.
Okay, we're gonna have to pack and close her for the night.
Okay, I'll talk to ITU.
Hot saline, please.
going to cause the rectus sheath as normal, boss?
Yes, I know, Rob. I know what I'm doing.
I'm only asking.
Close the rectus and the skin as normal, cover with the dressing.
Yeah, it's stable, but we can't control the bleeding. Yeah, they want to pack her and close her for 24 hours. Good, thanks. They can take her.
Thank you. Hot packs, please. Let's get them in. How long you got left?
2 weeks.
Let's try and get through it, shall we? Mr. Quinn, I'm Roger Hurley, the consultant. I'm afraid in order to save your wife, we had to perform a hysterectomy. Unfortunately, your wife has developed a very serious condition, disseminated intravascular coagulation, DIC, which meant that we couldn't control the bleeding. We've packed her abdomen with absorbent pads to soak up the blood, and we're relying on her natural clotting to stop the bleeding. If all goes well, we'll take her back to theatre tomorrow and remove the packs.
We tried everything we could. We couldn't save the womb. Your baby's on the special care baby unit. I could take you up there to see her if you want. They're putting a line into the umbilical artery. This allows them to monitor the baby's condition through pulse, blood pressure measurements, and so on.
How is she?
I'm afraid the chances are your baby's got what we call HIE, hypoxic ischemic encephalopathy, brain damage. Due to the lack of oxygen from when the womb ruptured to when we delivered her. I'm very sorry. Most babies do suffer long-term problems, but many don't. 20, 30%. Did you have a name for her?
Hope.
I'm just going to take your temperature, Maria. 36.5. I'll leave you to rest. Just buzz if you need anything. Roger, I don't know if you've already been informed, but Dr. Orton's on the unit.
She's back at work.
She had a miscarriage.
She was pregnant.
15 weeks.
I never knew.
Look, I'd ask someone else, but you're the consultant on call.
No, of course, Hazel. I'll see her.
Maria? Maria?
Maria, I'm very sorry for your loss. I also completely understand your animosity towards me. But please be assured, I will give you the highest standard of care.
Like you did all those other women? The ones who you crippled or mutilated? And you? What have you done to stop him?
Maria, your baby has died, but the fetus hasn't been expelled naturally. You understand we have to induce labor.
Not him!
time is it?
Don't know, 3, 4.
Shit.
What?
Why didn't you wake me?
Because I didn't think I had to anymore.
Shit.
I didn't think I had to.
Well, you do.
I got a lovely little something in the post this morning, Polly.
And what would that be, Tony?
What that would be, Polly, is 2 return tickets to St. Lucia. Arriving at 5 o'clock local time, so perfect for a cocktail or 2, dinner, on the veranda.
If I'm presenting in the morning, I'll probably just want to get an early night.
Nonsense. All work and no play makes Polly a very, very dull girl. Christ. She's got a uterus like a badger's arse. Tim, cappuccino?
Hi, Tony. Look, I have booked leave.
You're kidding, right? This is some kind of joke, is it?
No, Tony. I've been granted some leave, and I made it the week we're going to Santa Lucia.
We are not going.
Tony, we had a nice time together, didn't we? Wouldn't it be a nice time? In the sun, on the beach, in the lovely hotel.
Well, Polly did the research, so I'm taking Polly.
You said to Polly she would have to sleep with you if she came.
No, you see, that was optional. I'm taking Polly because she did a lot of work on the research project. She'll be giving a presentation. She'll be answering questions slightly more taxing than, would you like an umbrella in that cocktail? Dr. Gonzalez Rivera, if you didn't want to shag me, then you shouldn't have shagged me.
You tricked me. You are a very bad man.
Oh, yeah.
You've crossed off a substance K.
We finished our supply. No more's been ordered.
Why not?
Because it isn't helping.
Why aren't you on gynae?
I'm checking on a patient.
Louise is a waste of electricity.
We're going to test for brain death again.
You can't switch her off. She'll die.
She's already dead. That's why he's going to switch her off.
Can't believe it. She's going to die.
What do you expect? This is a hospital.
Is Tony around?
He nipped out for a coffee. Oh, it's been a while. I was about to send out the search party.
I've been to the theatres.
You can get a coffee in the cafe near outpatients.
Or from the canteen.
You've been to your machine, haven't you?
The one the drug company gave him, with his little name on it.
While you were there, did you polish your plaque?
Piss off, the pair of you.
It's cold.
I want to repeat the FSD study.
Why?
Because we deliberately skewed the data to make it appear like an ineffectual drug for an unimportant condition was actually commercially viable.
Well, maybe I should take Consuela to St. Lucia after all.
Tony, we committed research fraud in order to please our sponsors. It's unethical.
I never allow medical ethics to stop me doing what I think is right.
Christ's sakes, I'm trying to be serious, and all you can do is take the piss. It's like you're not in the least bit interested in the quality of the research that we're putting our names to. It's all about when we get to the conference, whether or not you get to get your leg over. Which you won't.
Anyone got any idea why we can't order blood tests or blood transfusions anymore?
I might be able to help you out there, Rob. It might well be that they pissed away the budget trying to hit the Department of Health targets. And now they haven't got any money left to actually treat the patients.
Very sorry to keep you all waiting.
Mr. Tennant. Mr. Whitman's being very difficult about the targets.
Thank you. As you all know, the hospital recently underwent its annual audit. We were measured according to our ability to achieve the performance targets set by the Department of Health. These figures have now been returned to the Department of Health, and we await their judgment. Very soon, we will hear whether we are a 3-star, a 2-star, a 1-star, or a no-star hospital. I cannot overstate the importance of this judgment. 3 stars shining on the sign above the hospital gates. 3 stars shimmering in every corridor and waiting room. That sends a message to every patient and member of their family. This is an excellent hospital. You will receive first-rate treatment. You will get better.
When the ventilator is switched off, Louise won't be able to breathe for herself. Her heart will continue beating for a short while, then it will stop too.
She's no longer in our hands. She's in God's hands. He'll take her, or he'll heal her.
I am ready to switch the machine off now. Does anyone have any objections?
Praise the Lord.
Maya, you might not think it now, but after a day or two, you'll feel a great sense of relief. Every doctor makes mistakes, and when every doctor makes a mistake, he can't let it haunt him or be crippled by it.
Maria, as soon as the pathogen starts to kick in, we're going to start pushing, okay?
Maria, if you want me to stay, please. Please. Ross is flying back from the States.
I should probably go.
No, I want you to stay. I want you to stay and see what they've done to me.
Okay, how are you feeling?
I'm ready.
Okay, now push. Keep pushing, Maria.
He started asking questions.
What sort of questions?
The sort of questions that a husband might ask if his wife stays out half the night.
What have you said to him? You've not said anything, have you?
I don't want it to come out like this.
Donna, you've got to tell him about us.
He's asked me to give him another chance.
Is that what you want to do?
We've been together a long time. We have a house, we have a life. I don't know.
Why not?
What do we have, Rob? What do we really have?
I don't have a name for it, Donna. Hiya.
Hi. I said we could bring in some things for her. She's not woken up yet, but I don't know, it's silly, really.
It's not silly.
You bullied Nicola into consenting to the hysterectomy.
I was trying to do my job.
Christ's sake, this bloody thing.
What does everybody think? Do I need Botox?
Buttocks? Yes, Consuelo. You definitely need buttocks.
Could someone call me back as soon as possible regarding our X-ray viewing box?
Today's list's been cancelled. Cutbacks, hopefully temporary. Fortunately, I managed to get a theatre for the patient we packed overnight. Are any of the TCIs in yet?
Just the one Rob was consenting her. Shall I tell her?
If you wouldn't mind. Sorry about all this, Donna.
I didn't know whether you get the BMJ, but I've circled a couple of O&G posts for you.
Trust Junior. Not recognised for higher professional training. Locum. Falkirk.
Yeah, well, I thought, you know, as a stopgap.
Thanks, Polly.
Sorry.
OK, Mama. We've reopened the rector's sheath. Mrs. Quinn's an unusual case. Don't often do this. Packs have soaked up the oozing and given all the bleeds time to clot off naturally.
I thought I was in on the theatre list.
Sorry, Rob.
It's fine.
She's going to do well, isn't she?
Very well.
Good.
Mr. Lake, I hear you're going to be unemployed soon. Perhaps there is a vacancy as a porter? Ah!
Hello, Paul. Any news?
A star rating? No, not yet, but fingers crossed. Roger. This tedious problem with your registrar. A nurse has reported him for flinging urine over her.
What? His own?
No, the patient's. I thought we'd agreed that we were pushing him out the door with a glowing reference.
I withdrew it.
You've withdrawn it, and now we've got a disaffected trainee chucking piss all over our nurses.
Well, that's not a problem. A couple of weeks he'll be gone. History.
I want us covered. Now, get someone to say that they brought new information to your attention and you felt that you had no option but to redraft your reference. The gynae ward sister.
Donna Ricks?
We've already got a note in her record about alleged racism. I'll get her to sign something and tell her that in return we'll clean her record.
Okay.
I mean, I wouldn't piss about. Just give her an ARN now.
How can I do it?
Polly, why don't you show Consuela how to do an ARM?
Not long now, hopefully, before we hear about our star rating. As principal consultant, it would be nice if you showed some support when I announce it. Are you Maria Orton's midwife?
Yes.
I understand she's been referred to a psychiatrist. Now, can I confirm that the referral diagnosis was of anxiety and depression with associated paranoid thinking?
It's all right, Hazel. Maria isn't paranoid. She just lost her baby. This has got nothing to do with her allegations against Roger Hurley.
Have it your own way, Tony. Make a little stand. I'll just take it up with a psychiatrist.
It's a very useful four-letter word. As a gynecologist, I'm something of an expert. You're the biggest one I've ever come across in my life.
You really should eat something.
Hello, Maria. Do you know where you are?
In a chair?
In the psychiatric unit. And do you know why you're here?
Because I tried to stop Roger Hurley from killing mothers and babies.
Pudenda. Not pure dender. I mean, what the hell is a pure dender, anyway?
Sorry.
We've received a very serious complaint against you, Mr. Whitman.
What's the complaint?
Oh, there are two, actually. The husband of a patient of yours claims that you referred to his wife's vagina as a wizened sleeve.
Wizard's sleeve. At least get the gag right. It's voluminous, big.
You don't deny it?
Look, the bugger was listening on the phone without my knowing it. Just taking the piss. I said I was sorry.
Well, probably a formal written apology will save the hospital's blushes, but that isn't the important one. A member of your staff has accused you of sexual harassment.
Which one?
I'm not at liberty to say.
Polly, shit. Anne-Marie. Theatre nurse. That little drug rep. Consuela. Shit.
The member of staff claims that you tricked her into providing sexual favors in exchange for a career enhancement.
Consuela got the idea in her head that there was a free trip to the Caribbean if she shagged me. I never promised her anything.
There's more. We received this anonymously. This is you and Dr. Gonzalez Rivera.
No. That's Anne-Marie, my secretary. Mine and Roger's. I presume she doesn't do that for Roger.
How many women are there? I thought you were married.
Look, I did not harass Consuela. I did not harass Anne-Marie. In fact, they both liked it.
You're in a position of power over them. That's the abuse.
They would still have let me shag them. They do that sometimes, women. They let you shag them.
A complaint has been made. It will be investigated. You'll be notified of our procedure in due course, and you may be suspended from clinical duties.
This has got nothing to do with my ability to look after my patients. I am a gynecologist. This could kill my practice.
Needless to say, your position as principal consultant is no longer tenable.
Tomorrow you'll have 250. And then you go.
What the hell do you think you're playing at?
We had an understanding. I would do a nice thing for you, you would do a nice thing for me. But you didn't.
I didn't know that that was what you expected out of it.
You thought I would have sex with you. Why? Oh, because I find you sexy? Listen, you should have asked yourself, why does this beautiful young woman want to sleep with me? You're not young, okay? Your body is not firm. You're hairy. When I touched you, I felt how old you were. You thought you could use me because you're a man. I'm powerful. Poor Mr. Whitman.
Well, the news has finally come through. Ladies and gentlemen, this hospital is now a 3-star hospital. Now, I was speaking to the chief executive only a few minutes ago, and she wanted me to tell you how much you all deserve this, for all the hard work you've put in over the year. And she also wanted me to tell you that these stars are not our stars. These stars are your stars. And I would like to make another important announcement. I have decided that the position of principal consultant in obstetrics and gynecology should now be a term appointment. And Mr. Whitman is to hand over to Mr. Hurley, effective immediately. Roger.
Roger.
Tony?
I bet you can't believe your luck, can you?
I wouldn't put it like that.
If you think I'm finished, you're wrong. You are totally fucking wrong. Give me 6 months, I'll have my old title back with gongs on. Because somebody somewhere will see you for what you really are. A useless, cack-handed management poodle.
No one sees me as that, Tony. My generation of consultants are appointed after roughly 8,000 hours of training. Yours had 30,000. I'm the future. Hello. Hi, Donna. How are you?
Fine, thanks, Roger.
This is something delicate. I'll be straight with you. It doesn't come from me, it comes from management. Do you remember a patient called Angela Strawberry?
Yeah, she had acute epiglottitis.
Rob Blake attempted a procedure he wasn't equipped to perform, and as a result, she died. As I said, this is delicate. I want to include this information in his reference, but I have to account for why it wasn't there before. I've drawn up this letter giving your account of Mrs. Strawberry's death, bringing Rob's failings to my attention.
I'd rather not get involved.
I know, but the management have said they'll look very favourably upon you for helping us out with this. Very favourably indeed.
As I said, Roger, I'd rather not get involved.
I think a failure to cooperate would make your position as gynae sister very difficult. Come on, Donna. Let's not make a song and dance out of this. Rob Blake will be gone in no time. He's just another doctor you've barely said 2 words to. Just sign the letter, please.
Fuck off, Roger.
How are you feeling, Nicola?
The operation was successful. The tiny vessels that were bleeding had clotted off. The wound was closed.
You cut up my womb. It was too badly damaged to repair. You would have bled to death. Here she is. She's so little to be on all those tubes. Do they hurt her? Hope hasn't gained consciousness yet, so I think we can assume that she can't feel any pain. However, the paediatrician says that there is some good news. Hope has started to have basic neurological reflexes, which is a sign of recovery. Will she get better? It's too early to say. Can I touch her?
Of course you can.
She's beautiful. However she is, she'll always be beautiful. I want him to go now.
Are you going home or are you coming with me? Why don't you ever choose?
Did she get those results?
Morning, Ma. How you feeling?
Good, Roger.
Really?
I made a mistake. But what you said was right. You made me realise that I've got to move on. Thanks, Roger.
Pleasure.
Oh, for goodness sake. Leave it to me, I'll get on to it. Sick of this.
I'm supposed to be finishing here in just over a week. Nobody wants to stay where they're not wanted. I'm going to apply for another post. I'd like you not to interfere. Let me have a decent reference and I won't be a problem anymore.
You blew the whistle. You say you didn't, you did. You think you can just count up how many operations a surgeon does, how often things go wrong, and that tells you how good he is? A patient lives or dies, they bleed or they don't. A wound gets infected or it doesn't. A condition recurs or it doesn't. You know it's not that simple. But you still pointed the finger. You're not fit to be any consultant's registrar, Rob. Or any doctor's colleague.
Roger. I've got nowhere else to go.
When I first met you, I thought, there's someone with a soft centre.
Rob, late.
Come to A&E. Straight away.
Who's cut?
Nine-year-old boy, 80%, third-degree burn.
Bear with me.
The baby! It's all right. Please tell me it's all right.
As soon as Mr. Hurley's made this nick in your vein, we can start giving you fluids.
I can put in a central line.
Doing a cut down. She hasn't got any veins.
The baby! What about the baby? Help me.
Madam, you have to keep still. Can you keep still, please? I've already done that.
Who called for assistance? Look, my instructions were as clear as day. Who called him in?
Look, do you need anything, Mr. Hurley?
No, I'm fine.
All right, that's your own heartbeat. Bloody thing. Madam, please, keep still. Has anyone told her?
I'm very sorry, but we can't find your baby's heartbeat at the moment.
Tim, get me a central line.
Roger's doing a cut down.
Keep still, please. What do you think you're doing?
Patient needs a central line. I'm putting one in.
Look, I'm in charge here.
Central line will get more fluids into her faster. Okay. Look over here for me, please.
I'm sorry. I know it's sharp. I'm sorry.
You have to keep still.
All right, get ready to connect up. I'm almost in here. Maya, connect up. For fuck's sake, Maya. Tim?
Right, it's okay.
You're gonna be fine. Anyone tell me why the trauma team isn't running this, please?
They called him in because of the obstetric problem. The trauma team are busy dealing with her son. But Hurley insisted that he could handle this by himself. I mean, he's the O&G principal consultant now. He's got to act like it.
This woman needs burns care. She needs to be taken to ITU now.
Roger's bound to be sorting that out right now.
What's the matter with you?
What's the matter with you?
She's lost the baby, but I've managed to stabilise her.
It was the boyfriend. He kicked the stuffing out of her and her son. Killed the baby. He poured petrol on both of them. And then lit a match. What can you do?
When the fuck's the doctor gonna see me?
I'm an A&E registrar. I'll pay to see him now.
Thank you.
The oxygen will help you breathe. I need to listen to your chest, please.
What the fuck for?
You've got smoke inhalation. You could have lung damage that'll cause you chest problems for the rest of your life. Sit up. Breathe in. Out. In. Out. Again. Out. Why'd you do it? Use this. Why'd you do it?
Fuck off!
Your baby's dead. Your girlfriend's probably gonna die.
Fuck him.
We've got to get the baby out. As soon as it dies, it starts to macerate. That means its skin peels off. I'm gonna have to crack a hole in your baby's skull, suck its brains out through a tube so its head collapses so I can get it out.
Fuck him.
got a reaction to the smoke that you've inhaled. We'll have to give you an injection to take down the inflammation.
Whatever.
Roll up your sleeve, please.
Just get on with it, dickhead. What's the matter with you?
Hey, you dickhead! What the fucking hell are you doing?
You think you're going to be running around, saving people's lives, with the tail of your white coat flapping around your ass like Batman's fucking cape?
Get little victories. This is a good life. I wouldn't choose another.
What about all the shite?
You learn to walk away.
I'm sick of walking away. Hello, it's Mr. Lake here. I'm calling from the hospital. I want to talk to you about your mother. We didn't tell you the whole truth before. We should have, but we didn't. We walked away and let you pick up the pieces. Your mother had acute epiglottitis. Her throat became swollen, and she was choking to death. I decided to carry out a cricothyrotomy, even though I hadn't seen one done before, let alone done one myself. I thought I might be able to manage it, as I thought I was the type of person that didn't make mistakes. I made a terrible mistake. I carried out the procedure wrongly. It was clear to see from the start that I didn't really know what I was doing, but I didn't stop. I kept trying and trying to make things right for your mother, but I was making things worse.
Your mother must have suffered terribly. Because of what I was doing to her. I was just trying to make things right, but things weren't working out that way. It's my job to make people better. But your mother died. I'm sorry she died. I'm very sorry about my mistake. I'm sorry you haven't got a mum anymore. I'm sorry.
Why are you telling us this now?
To be judged.